Me, can you focus on me?
Hi everybody, welcome back to my YouTube channel. In this video, I'm going to talk about what I do as a non-bedside nurse. So I am a medical records reviewer. I work for a medical billing company in Vegas. So basically the company that I work for, we service over 40 specialty pharmacies who provides therapy to patients with very rare diseases and illnesses. Some of the patients that we service are patients who have multiple sclerosis, rheumatoid arthritis, lupus, muscle dystrophy, stiff mass syndrome, and countless other diseases. So the company I work for, we provide services, clerical services and billing services to infusion nurses who are independent nurse contractors. So in other words, the RNs that we service, they do not work for us. Like, we're not their employer, but they do use our services for billing purposes. So basically the nurses will visit the patients in their home to provide IVIG infusions. For those of you who don't know what IVIG is, I'll give you a quick rundown. So IVIG is an intravenous immunoglobulin therapy. IVIG is a product made up of human antibodies that can be given through the IV. Immunoglobulins are the body's natural defense against viruses and bacteria. So basically, if you are deficient in immunoglobulins, we do immunoglobulin replacement. Or if you have, like I said, any of the illnesses that require IVIG therapy, then we provide services to those patients. So the nurses will visit the patients in their home, infuse their medication. They are to document their care, of course, on the nurse's notes. Once the visit is complete, the nurses will send their documentation to us for review. So as a medical records reviewer, I review and I audit these nurses' documentation, their visit records. So I review their paperwork to ensure that everything is accurate and everything is complete. I work with the West region except for California, so Nevada, Arizona, Utah, Washington, Colorado, and I also work with Central region, so Louisiana, Texas, Mississippi, North Dakota, South Dakota, and a couple other states. So as a medical records reviewer, although we're not working at the bedside, we are licensed nurses, so we use our clinical skills to basically apply the medical record review process. For example, we not only have to make sure that these nurses are correctly documenting the correct medication, that the name of the patient is spelled correctly, the correct date of birth. We have to make sure that they're documenting the correct pharmacy because we work with a lot of different pharmacies. We also have to make sure that the nurse is signing their documentation and that the patient is signing their nurse's notes, because basically the patient's signature is their consent for treatment. So if you're familiar with nursing notes and nursing documentation, you should already know that there is an assessment, a head-to-toe assessment that every nurse is to fill out when they're visiting the patient. The nurse is supposed to document the medication that the patient is getting, the dosage, the IV site, if they ran into any complications, if the patient had any reactions to the medication, the nurse is supposed to document everything. So my skills come into play when it's time to review the infusion rates. We have to make sure that the nurse is following the doctor's order for the patient. So we have to make sure the nurse is infusing at certain rates. We have to make sure that the infusion rates are matching up, that they're not going over the max rate, that the patient is tolerating the treatment well, and we have to make sure the nurse, if there are any adverse reactions to the therapy, that the nurse is documenting that as well. So I also have to make sure the nurse is documenting the correct visit time. It may seem like an easy process, but realistically, the nurses are seeing several patients in a day, sometimes back to back to back to back. And we're human. You can forget to document certain things, and that's fine. If I get a nurse's note, for example, it's my job to review the nurse documentation as well as their invoice, because like I said, we are a medical billing company that provides billing services for these nurses. So we're not only reviewing their documentation, we're reviewing their invoices that they're sending in for payment. So basically, I can give you a scenario. A nurse sees a patient that has a 3-hour infusion. Okay, so the infusion from the time they start it to the time it's complete takes 3 hours. Okay, the pharmacies allow a 30-minute pre-infusion assessment time. This is a time where the nurse starts the IV, checks the vital signs, assesses the patients, give any pre-meds like Benadryl, Tylenol. This is just like their initial assessment. So that's 30 minutes. And then they have a post-assessment time of 30 minutes. That's after the infusion is complete. So once the infusion is complete, they have to monitor this patient for 30 minutes to ensure no reactions are occurring, vital signs are staying within normal range, and just to assess whether or not the patient is tolerating that infusion well. So a 3-hour infusion time plus the 30-minute pre and post assessment time, that's a 4-hour total visit. Okay, so if a nurse turns in an invoice and she's trying to bill for 5 hours, and the nurse's note says that her time in and time out is 4 hours, it's our job as medical record reviewers to verify that time with that nurse. So I usually will send a text message, because a lot of times they're with the patient and I don't want to call and interrupt their services. So a lot of times I'll just send out a text message to the nurse and say, hey, I'm reviewing your nurse's notes for such and such visit on such and such date. Your documentation says 4 hours, but your invoice says 5 hours. I just want to confirm which is the correct time. So that can go either ways. Either the nurse mistakenly wrote for 5 hours on the invoice, and then her nurse's note says 4 hours. We have to verify. The nurse can either say, hey, I mistakenly wrote 5 hours on the invoice, I meant to write 4 hours. Or she can say, oh, well, I wrote 4 hours, but it actually took me 5 hours because the patient was a hard IV start and I had to try 3 different times to start the IV. Or she can say, the infusion ran a little longer than expected because one of the IV site infiltrated and I had to rotate the IV site, and that took a little while. So either way, when we catch a mistake like that, or when we catch something that is not adding up, we are supposed to contact that nurse, get verification and confirm things, get everything cleared up, and then we revise either the note or the invoice to match up to what is correct. We also have to make sure that the nurse is documenting the lot number for the medication as well as the expiration date of the medication. We're responsible for staying current and up to date basically with the lab schedule. So some patients are scheduled to have labs every 2 months, every 6 months. It just depends on what the order says. So if we have a patient that we're due for labs the day of the service, and we notice that the nurse did not document that any labs were drawn, we then have to contact the nurse and we have to verify if the labs were drawn. If they were not drawn, we need a reason why. Sometimes the nurses did not receive any lab equipment from the pharmacy and that delays it. So either way, we have to contact the nurse, get verification on the labs. Whenever we get verification, we do have to let the nurse scheduler know. So yeah, that's just some of the stuff that we do. So even though medical record reviewers are not working at the bedside with patients, we still are using our nursing knowledge to be able to audit, review, revise, and make sure everything looks okay and that everything looks, efficient enough to bill to the pharmacy for payment, basically. If you are a nurse and you are tired of working at the bedside, if you're burnt out, don't give up hope. There are a lot of positions and a lot of other directions you can go as a nurse. You don't have to work in a hospital. You don't have to work in a clinic. You don't have to work home health if you don't want to. If you want an office job, you can work in an office as a nurse and be just as fulfilled and just as satisfied if that's what you want. So I did write down a few jobs that you can look up either on Indeed or LinkedIn, or you could just Google them. So some non-bedside nursing jobs, there are case management. So if you're looking into becoming a case manager, that's one option. Utilization review is another option. A nurse documents coordinator, I think that's similar to what we do as a medical records reviewer, but they work directly with the pharmacy, but they essentially do the same thing we do. Prior authorization nurse also works with health insurance companies as well. And the last one I have written down is clinical documentation integrity specialist. Yeah, so if you're interested in non-bedside nursing roles, you can look up any of these roles, get the job description of what the role is and what's expected of a person working in that role, and then you can decide for yourself if that is a good fit for you. Yeah, that's pretty much what I have today. Of course, I'm working with medical records, I'm working with private health information, so it is my responsibility to remain HIPAA compliant. So we are HIPAA compliant. Yeah, that's pretty much what I do. It's very easy. This is not a long video at all because my role is very easy, very simple, very detail oriented, but as long as you know what you know as nurses, we know how to document, then it's really not that hard. Yeah, so that's pretty much it for this video. Thank you guys so much for tuning in. If you guys have any questions, go ahead and comment them down below and I'll do my very best to answer them for you. Until the next video, I'll see you guys later. Bye.
Can't focus on me.